All right, let's discuss this some more. I'm now being joined on the program by Dr. Alera Roberts, who is a public health consultant and a senior lecturer at the College of Medicine, the University of Lagos. Thank you very much, Doctor, for joining us on the program. As a doctor yourself, how badly do you feel at what is going on at the moment? I mean, resident doctors on strike now for the past 3 weeks.
I think it's actually unconscionable. Needless to say, I mean, the pressure of work on the rest of the physicians that are working is already to consider that we are having to deal with the pandemic. We're having to deal with an influx of cases that were not properly managed during the pandemic and have now become quite serious. When you think of all what is going on, the fact that the federal government can allow this to continue for so long is completely beggars belief. I can't understand why people have allowed that.
And what is even complicating matters here is that it's not just the federal government here that is involved. I mean, almost all the states are involved in this, and because the doctors are saying that even the states especially have actually not met their demands, and that, you know, this is even more on the states than the federal.
And I'm sorry, DEJI, I'm actually going to object to the use of the word demand, because many of these doctors at state level have actually done the work that they're supposed to be doing and have not been remunerated for it. So, I mean, how can you work for so long without a salary?
Just doesn't make sense.
It just doesn't make sense. So this is not a demand. This is a promise that the government has refused to keep. Whether at state level, whether at federal level, you've got people who are working who are not being paid. How do you call that a demand?
And you must have seen that report of Nigerian doctors who were going to apply for jobs now in Saudi Arabia and all of that. I mean, it's not the first time we would see Nigerian doctors do that, but it's just an irony that this time it's happening at a time when doctors are on strike. Tell me, in terms of brain drain now, how much is our healthcare sector affected?
I mean, on a scale of 1 to 10, where 1 is operating optimally and 10 is completely broken down, I'd say we're approaching 9.5. I mean, we're here in Lagos and we've got ICUs that are full. We've got emergency wards that are full. We've got places where we want to manage COVID patients that they have no beds available. We have patients turning up at the accident and emergency and being turned back because there's no bed available. And now, in the layman's scheme, this is not just a matter of going to the market and buying more beds and going to a mattress company and buying more mattresses. We have to think of the personnel that need to be attending to the patients on those beds. And everybody keeps saying the doctors, the doctors, the doctors, and the nurses, and the physiotherapists, and the pharmacists. We have a complete breakdown of our healthcare system. From cleaner to clinician, people are really leaving. And if you're in a place where you're working and you're not being paid, and they offer you a job elsewhere, that you're not only going to get paid, you're going to get paid 10 times what you're being paid here, that is not being given to you. Hello?
I mean, of course, if I were in their position, I certainly would take the offer. But I mean,
a friend of mine said that, are they recruiting engineers as well?
It's funny, but it's actually not funny. And if this continues, I mean, because there's a report out there that we have just around 35,000 doctors for a population of around over 200 million people, and it appears our country has now become a poaching ground, so to speak. I mean, this doctors graduate from the universities, before you know it, they're out of the country. I mean, we just can't continue like this. Then, obviously, the healthcare sector will take would certainly get worse than what we have at the moment.
Well, don't forget, I mean, for us in the education sector, who are the medical educators, it gives us a vicarious pleasure to know that we are training to such a high standard that the students we train and graduate are capable.
But then it must make you feel bad that your students are not staying here and they're choosing to leave.
Not at all. Not at all. Don't forget that the networks that we make between students and educators never breaks. And if a lot of these students, don't forget that they're being supported by parents, by guardians, by well-wishers, and they then cannot come out of school, start a job and not be paid so that they can pay them back. You know, so if they get a job abroad and they go and they're able to support their parents, their guardians, who are we to stop them from doing that?
And you know, the irony of this all is that after now, even when this is resolved, there's no assurance that 3 months down the line, we wouldn't have another strike, because this is the second strike in just a space of...
DG, you have to count since 1984.
No, I'm talking for this year alone. For this year alone, okay. This is the second.
For this year alone. I mean, this one went on the day they started the first strike this year, and the president left the country for medical care. I mean, that wasn't just a slap in the face. That was somebody really poking fingers in the eye. And several people have said it, and it bears repetition. If our political officers and people in charge needed to stay here and get their healthcare needs sorted out, we won't be seeing this happen. We simply won't be seeing this happen. And I have a big question to ask all those hospitals abroad that are taking Nigerian money, you know, for this. Ask the people who are coming to pay, where do they get the money from?
Of course, they wouldn't do that. You don't expect them to do that. But thank you very much, Dr. Alero Roberts, Public Health Consultant and Senior Lecturer, College of Medicine, University of Lagos. Thank you very much for your time, madam.
Thank you, DG, for having me.
Thank you very much. Well, that's how much we can take on the program this week. Thank you very much for watching. I'll see you again next week. Bye-bye.